Today, we're really excited to be invited to talk about one of our new innovations called Recruit. And I'm just going to go over and give you an overview of what Recruit is and the different tools that we offer that you can request to assist you in your recruitment plan. So, everybody see that okay? I get just share. Sorry, when I hit the forward button. There we go. Can you see that okay?
Yeah, looks good to me.
Okay, just a minute. Oh, wow. This decided to jump out. Okay. So one of our system-wide innovations in 2022 was to improve patient access to research. And the way we have done this is we created a committee called Recruit. It stands for Research and Epic Collaborative Recruitment User Integrated Team. Excuse me. And this is a system-wide committee who governs and oversees the use of UCHealth's EHR for recruitment. Membership includes individuals from Research Administration, UCHealth Epic team, UCHealth's Digital Patient Experience team, as well as a Health Data Compass Unit dedicated resource. So the purpose of this committee is to develop and establish infrastructure such as our Recruit tools, and also includes education and resources for all of our Recruit initiatives. And the way our tools work is that they utilize Epic and My Health Connection to connect UCHealth patients with these research opportunities. So we have some guiding principles that provide guidance as to what is required in order to use our Recruit tools. So the first one is that they may only be used for prospectively enrolling studies. So it's not intended for retrospective studies or QA or QI projects. The PI of the study must be a CU Medicine or UCHMG provider, CU research faculty, or a UCHealth employee. The accrual goal for the study must be greater than five or more participants. The study must intend to be open to accrual for at least 1 year. Now, we understand that if you use the Recruit tools and you meet that recruitment goal sooner than a year, that's totally acceptable. But at the outset of the request, the expectation is that it should be open for at least 1 year. It also requires an open to accrual status in Encore. So we need to have the study in Encore and in an open to accrual status. And importantly, we understand that there is a startup period, and you may be interested in requesting the Recruit tools even before the study is open to accrual. So we do allow this, and then we will make the tools available as soon as the study is open to accrual. Importantly, too, the use of these tools require potential participants to have My Health Connection accounts. So some of the tools that I'm going to discuss today, such as our reports, they will only include individuals who have an active My Health Connection account. So we are only looking at accounts or patients that have an active My Health Connection account. And another tool that we have called the I'm Interested button, those will only be pushed to individuals who have had an active My Health Connection account and have had a visit within the UCHealth system within the last year. So these are the general requirements that we have in order for a study team to request our Recruit tools. So here's just a brief list and overview of the different tools that we currently offer. The first one is called Focused Recruitment Messages. So patients receive recruitment messages containing information about a research study through My Health Connection. So you'll send an in-basket message with a recruitment script to that individual, and they will receive it in their My Health Connection account. We also have what's called the research preference profile. So patients use My Health Connection to indicate their research interest by providing their preferences for the types of research studies that they want to learn more about. And patients can update or change their preferences over time. And then we have what are called recruitment lists. And through lists, teams obtain potential recruitment contact lists. Another tool we have is called the I'm interested button. With this particular tool, it displays a virtual flyer to potential eligible patients and allows them to indicate interest in a specific study. And then we have e-consent. We now are offering e-consent so that patients can use My Health Connection to electronically receive informed consent forms to review and sign to participate in a research study. So instead of using a paper informed consent form, we can now offer e-consents that are routed and signed through My Health Connection. So for the recruitment messages, they are intended to contain information germane about the research study, as well as follow-up contact instructions. And the template that we offer is shown on the right-hand side of the slide. So this is what our template looks like, and study teams would go in and modify this template to be appropriate for their specific research study. And then once this has gone through all the approvals and the study is open to approval, the research team sends this recruitment script to a potential participant's My Health Connection account using in-basket messaging and Epic. Importantly, a recruitment script is required for all recruit tool requests. So you can request just the use of recruitment messages, and recruitment messages can be used when a study PI or sub-I has a clinical relationship with a patient. But in addition to that, all of our other recruit tool requests do require the use of this recruitment script. So for all of the requests, just know you're going to have completed the recruitment script and send that to us. And again, the template script we do provide, and this can be found on the Research Administration SharePoint site. When using the I'm interested button or receiving lists of potential participants, the recruitment script must be used for first contact with potential participants via My Health Connection. So the very first time you reach out to somebody that's been identified on a recruitment list or has responded to the I'm interested button and indicated that they're interested, you're going to send this recruitment script via in-basket messaging to their My Health Connection account. So the next tool that we have is called the research preference profile. And this is a questionnaire that was sent to all UCHealth patients with an active My Health Connection account starting in April of 2022. And this is what it looks like when a patient receives this in their My Health Connection account. On the right, it has a description of what the participation preferences are. And then on the left, it has two questions. One asks if they would consider participating in research studies as a healthy volunteer. And then the second question indicates, well, which areas of research would you be interested in? And you can see there's a whole host of different categories that they can select from. They can select multiple areas of research interest. And when they do hit continue, the patient responses are sent to and stored in Epic. And then patients can update and change their profile responses at any time. They can elect to indicate another category, they can be removed from a category. And again, this is all set and stored in Epic. So here is a graph showing all of the different research preference profile responses that we've received since April of 2022 when it went live. We offer 41 different categories, and these are all in alignment with clinical trials at CU and UCHealth, and is connected to Encore. And even without us marketing this research preference profile questionnaire, to date we've had 7,200 individuals respond to it. And there's about 2 million My Health Connection account users. So So far, about 7,200 people have been able to find this on their own and have elected to complete it. And on the graph with the different colors, you can see all of the different categories that are offered by name, and then the number of respondents that have indicated interest in that category. So currently there is a huge interest from UCHealth patients in studies relating to aging, women's health, sleep, mental health. And so you can see in this graph kind of the number of individuals that show a particular interest. And what I want to really point out here is that when a research preference profile list is requested from Recruit, that when we try to match eligibility criteria with patients, we're only querying patient EMR from those patients that have actually responded to a selective category. So for cancer, let's say you have a cancer study and you want to use the research preferences profile list, we would only match your eligibility criteria to those individuals. And it looks like there's about 1,800 that have said they're interested in cancer. We would only look at their records. We would not look at any other records. And then if there's a match, we would provide that on the list. So like I mentioned, the research preference profile recruitment list is one of the tools that we use, and it does, this particular tool is useful in helping teams identify potential participants without having a treatment relationship with the study PI or sub-I. So this is a really great tool for PIs that are PhDs or PharmD, or maybe there's a provider that does see patients in clinic, but they need to, for a particular study, identify patients that they wouldn't have a clinical relationship with. So this is a mechanism to potentially identify participants for these particular types of PIs. As I mentioned previously, we take study inclusion and exclusion criteria that we ask study teams to provide to us when they submit our request form. And we use these criteria to identify potential participants that have indicated an interest in the area of research associated with the study. Now, study teams can pick more than one category or area of interest. Let's say, you're interested in, you have a cancer study, so you want to look at patients that have indicated interest in cancer, but you also have, it has an immunotherapy component, and you're looking for cancer patients with an immune disorder or something like that. You can pick more than one category for us to potentially query patients from. We allow teams to determine the cadence of data pools for these lists, so they can request that they be sent weekly, bi-weekly, or monthly. Again, to reiterate, that first contact must be made using My Health Connection. So if you get a participant on a list, you're going to send that recruitment script through in-basket messaging to make that first contact. And then second and third attempts to contact them can be made using any IRB-approved recruitment method. And importantly, when we provide these lists to study teams, teams should always verify potential eligibility prior to contact. So you should be looking in the EMR if that's an approved IRB method, just to make sure that the eligibility, that patient meets your eligibility criteria. And if they do, then you can send them the recruitment message. So in addition to the research preference profile list, we offer another type of recruitment list. And this can be requested for potential participants that have a pre-existing treatment relationship with the study PI or sub-I. And we do have a question on our request form that asks which potential participant lists are you requesting for the study? And for this type of list, you would select a recruitment list, with whom the PI or sub-I has a treatment relationship. And research administration is partnering with Health Data Compass, and we have a unit dedicated resource who serves on the recruit committee. And when we receive requests for these type of recruitment lists, this individual provides the list for potential participants for prospectively enrolling studies. And this will be routed to and fulfilled by recruitment. So while we have somebody from Compass fulfilling that request, it gets routed to and fulfilled by recruit. So the next tool we have is what we call the I'm interested button. It's a virtual fire push to potential patients and allows them to indicate interest in a specific study. So this is an example of what that I'm interested button would look like. It has a study title, and this study title can be a patient-friendly title. It does not need to be the actual study title. And then it provides a description of what the study is about. In addition to that, it will also display who the principal investigator is, and it will also list any study coordinators that are associated as a research study coordinator in the staff tab in Encore. So when this button gets pushed to patients that meet the study's eligibility criteria, they would receive this, be able to read information about the study, and then determine whether they're interested in learning more information about the study, or maybe they decide that they're not. If they are, they can select the I'm interested button, and that information gets sent back to Epic, where it becomes available to study teams via a research coordinator dashboard. And this is an example of what that Epic dashboard looks like for the I'm interested button. It will populate the patient's name, the date of birth, other information. You'll see that it will have indicated an enrollment status of interested. And so when an individual indicates that they're interested, we ask again that study teams go through a process to determine their eligibility, and then there's a number of steps as to how you should follow up with them. And as you can see here, if a particular research coordinator is involved in multiple studies, each study will populate in the single dashboard. So there's not different dashboards for each study. There's only one single dashboard that will show the interested status of multiple studies if multiple studies have this particular tool active. We do provide detailed instructions on how to utilize the Epic dashboard and how to respond to a potential participant when they do indicate they're interested. This is on our Research Administration SharePoint site. So we encourage everyone to go and watch this so that they know what the step-by-step requirements are to use this button correctly. As I mentioned, teams here will provide a patient-friendly facing title and description. Teams must respond to all I'm interested requests, and we ask that this be done within 72 business hours of receiving a response that says I'm interested. So study teams should be monitoring that dashboard on a consistent basis. Now, if once a patient says, hey, I'm interested in learning more about this study, we ask the study teams to go and again, verify eligibility, just make sure that they're a good candidate. And if it is determined that they do seem to be potentially eligible, the next step is to send the recruitment script via My Health Connection messaging. So you're going to go into the inbox or go into InBasket and insert your recruitment script and send it to them. If they're deemed ineligible, then we ask that study team send them an ineligibility smart phrase text via My Health Connection. And all that information is provided in the training video that's accessible on our SharePoint site. And we just want to make sure that patients who have indicated that they're interested receive some kind of a response. Even if they're not eligible, we want them to know that their response was received and that they were deemed ineligible, but that we hope that they'll participate in a future study. So we want to keep this a very positive experience for UCHealth patients. Now, if an individual selects not interested when they receive the I'm interested button, teams still may approach the patient regarding the study. There is nothing that says that you can't approach them via different mechanism. So if the PI has a treatment relationship with this individual in the clinic, they are more than welcome to talk with them about the research study to see if they still might want to participate. We ask that teams inform the recruit committee when there are any patient complaints by sending us an email with detailed information to our email address at UCHealthResearchAdmin@UCHealth.org. And finally, teams must update Encore with a close to accrual status to end the display of the I'm interested button. So we have a report that lets us know when a study team has changed the recruit or the status in Encore to close to accrual. So just want to point out, it's really important that in order to display the end of the I'm interested button, this is the current mechanism that we are utilizing. The final tool that I want to share with everyone is e-consent. And here, patients receive electronic informed consent forms through My Health Connection, which they can then review with teams and sign to participate in a research study. So again, here's just an image showing what it looks like when the patient receives an e-consent request via My Health Connection. So they'll go into their research studies page, and they'll see that there's this research consent waiting for them. They can open it up and they can review it with a study team member and then sign the consent. If they choose to sign the consent and enroll in the study, once they've signed, that signed consent will again be available in Epic to be countersigned by the study team. That's kind of a general overview of how that process works. And again, we have a learning tool that we've created that's available on the Research Administration SharePoint site that steps research coordinators through how to complete this process with e-consents. Importantly, Epic is 21 CFR Part 11 compliant. Signed e-consents are available in Epic for study monitors and auditors to review. E-consents sent via My Health Connection do not need to be sent to Health Information Management for upload because they're already in Epic. Final signed e-consents are located in the consent tab in Epic Chart Review, so they're readily accessible. And then participants have access to the signed e-consent document in their My Health Connection account in perpetuity, so they can always go back into their Health Connection account, review it, download it, print it at any time. So I just want to go over the submission process when you're ready to request the use of our recruitment tools. So the first step is to submit the request form. The request form is located on our Research Administration SharePoint site. And we actually have two different forms. One is specifically if you're requesting e-consents, and then the other one is used to request all of the other tools, like the recruitment list, the I'm interested button, messaging, all of that. Once a study team has submitted to use tools, the recruit committee will review and approve the submission, and that can take up to 3 weeks. If the submission has requested the I'm interested button description, the I'm interested button, or all of them should have a recruitment script, those two items have to go and be reviewed by the digital patient experience committee. So the next step is we would submit the I'm interested button description and the recruitment script to DPX for review. They would review it, make any revisions, and then we would email those changes to the study team so that they can review them as well. Let us know if there's anything they would like to see changed. If not, the next step for the study team is to request IRB approval for the use of the recruitment tools for that particular study. And then once the IRB has reviewed and approved, well, I should say, let me take a step back. While the study team is seeking IRB approval, the next thing that we do on our end is we actually build the recruit tool. So we start to, create the reports to provide the recruitment list, or we build the I'm interested button in Epic and get it ready for use. Now, the recruit tools only become available for use after all IRB approvals are received. So if a study requests the use of more than one recruit tool, let's say 3, then we have to have received IRB approvals for all 3 before we will even release 1, okay? For our recruitment list, we have to have the signed PI attestation. And then finally, the study has to be open to approval. We won't release any recruitment tools until this step is completed. We've had a number of study teams reach out and ask us what they should be submitting for to the IRB for approval. And essentially, what I want to point out is IRB approval is required for all requested recruit tools. So if you request research preference profile list, you need to have the IRB approve the use of that tool. Same thing, if you have PI sub-I treatment relationships list requested, you need to seek IRB approval from the IRB of record for that as well. So you can see it doesn't only just include IRB approval of the I'm interested button and the recruitment script, but it should include IRB approval for any and all tools that are requested. With e-consents, if there is a change that is made to the e-consent in order to make it compatible for us to build it in Epic, again, we're going to ask that the IRB has approved any changes that are made to that e-consent document before we will complete the build and release it. So the IRB review submission not only should just request the recruit tool in general, but it should also include specific details about the tool and whether the study team will be accessing the EMR to verify eligibility. So like I said, with the I'm interested button and the list, we want study teams to verify eligibility before they respond to a particular individual. And so the IRB needs to know that you will be potentially accessing an individual's EMR record to complete that step. So that should all be included in the IRB review submission request for approval. So we provide information about recruit via 2 primary mechanisms outside of giving presentations. So the first is we'll send out information in the weekly Encore newsletter if there's a change that's been made to one of our recruit tools, or we feel that we need to communicate some information about a recruit tool to study teams. And then we also have a ton of information on our research administration SharePoint site. And down below is just a snapshot of what that looks like. But you can see that we have a tab here that's called Recruit. And then we have a number of sub tabs that have each of the different tools and information about them available, as well as a description about the submission process here. So we encourage you to go check out our research SharePoint site if you have any questions about Recruit. You can also request a one-on-one meeting with us. If you have additional questions that you can't find the answer to on our SharePoint site, that is also located here on our main Recruit page. And again, I just want to point out that being able to access our SharePoint site first requires access to UCHealth, the source. So if you don't have that, send us a quick email. We'll send you instructions on how to obtain access to the source. And then once you have that, you'll be able to access our SharePoint site. So again, as I mentioned, you can always schedule a meeting with us to discuss options for a specific study using our request submission form on our SharePoint site. And then also, you can always send us an email. You can send it to our research administration email, or you can also reach out to Lori, Marissa, or myself at any time with any questions that you might have. And again, we'd love to hear and receive feedback on our Recruit tools and the process, or any ideas that you have for future recruitment mechanisms. We've had a few study teams that have already done this, and it's been incredibly helpful. So again, if there's any ideas or any thoughts that you want to share with us, please don't hesitate to reach out and let us know about it. So that's all I have for today. Happy to take any questions that you might have about our tools.
Hi, Kristen. I've got a general question. You shared a website in one of your slides that is should show a list of the clinical trials on the UCHealth website.
Oh, yeah.
And I'm just wondering how those lists are generated. Because I just looked up like my team and my disease site to see what studies were listed, and just wanted to know how you guys get that information.
Marissa.
Yeah, so the UCHealth Clinical Trials website links directly to an interface we have with Encore. When a protocol is open to accrual, specifically at UCHealth sites. So that is defined by what is the study site in the institution tab. It populates on that interface feed. A couple of things to note, the SIP console has to be configured in Encore. That's something we require prior to OTA, so that should happen. And then there is a checkbox in the PC console in Encore that says exclude on web. If that's checked, it won't populate on the clinical trials page. The categories that we have offered there are mapped based on a keyword matrix that we have for any keywords that are found in the title, in the flow charts, in the description of the study in Encore. And then when a protocol is updated to close to accrual in Encore, it falls off that list. So only projects and studies that are open to accrual at UCHealth are not excluded on web will populate on that website.
Okay, great, thank you.
And if you're missing one or expect to see one that's not there, you can email me directly.
Okay, sounds good.
Are there any other questions?
We've got one in the chat.
Sorry, Grace.
Oh, that's okay. Yeah, just will signed Epic e-consents be transmitted to Encore from Heather Tobin? Thanks.
They don't get transferred to Encore. So, sorry. So study teams are still required to go into Encore and indicate which version of the consent was signed, and then populate the date that the consent was signed. But the step that's now, that doesn't, no longer needs to be completed, is you just don't have to send or email the actual signed e-consent document for upload into Epic to HIM. Excuse me. Sorry about that. Anything else? Again, we're always happy to answer questions, so feel free to send us an email.
Okay, thank you so much, Kristen and Marissa. I'm going to put in our sign-in sheet in the chat one more time, just in case anyone missed it and wants to make sure they clean their CEUs. And also, I would like to remind you guys that there will be a survey sent out. It should actually pop up in your browser after you exit the meeting. And if you could take that and just provide some feedback on what you'd like to see at future Lunch and Learns, that would be fantastic. So thanks so much. There's the link to the sign-in sheet one more time. Yeah, thanks for joining us.
Thanks, everyone.
Thank you.